All right, this is one that we're going to throw in here as a bonus because it got really good in 2025, Caregiver Training Services. So this one's called CTS, and Kathryn, I'm just going to let you take it from here because I know you're really excited about this one.
I am. I think this is just another example where care managers, providers, everyone, we've been doing it this whole time. So to have this kind of specific recognition and call out on the significance feels like our efforts aren't going unnoticed. So this is not necessarily new. It came out last year, but we're also now, what is new is the expansion of caregiver training services. So it's now accommodating other, it's broadening what it includes. So you have wound care, infection control, behavioral health management, or modifications. All of these services, which is what I think is most exciting, can also be provided via telehealth. That I think is, again, a huge step in health equity, making sure that people who need the help, need the support, it's not so challenging for them to get there. So I think this is another move where they're recognizing the significance that we have to support these patients and making sure you're getting reimbursement for that. You can see the reimbursement here. Dan, did you want to speak to this reimbursement?
I think it's actually pretty good. I'm $32 for a half an hour discussion. Like you said, many on this call do this already and get $0 for it. So, let's say you have a new patient with dementia and you want to educate the caregiver, you probably would have done that, anyway, but why don't you get $32 for it? So I love it. And if you go over, you get paid for each 15 minutes. And then the last one is interesting too, face-to-face group caregiver training, right? So let's say you have a conference room in your clinic, right? And you want to focus on a certain area and do a group training. That's $743 per person, in the group. So, let's say that, you have a full room here, you're multiplying that and getting that for each additional patient in your training. So I think there's a lot of opportunities. I'm kind of glad that this is something that CMS is focusing on, because for many patients, that caregiver is the one that has the biggest impact on the patient's wellness and management of their conditions.
Absolutely. Dementia example alone. Yeah. We rely on caregivers to continue all of the support outside of the office. Definitely.
Yeah. And the caregiver, Kathryn, doesn't have to be like a, home health nurse. This could be the patient's son or daughter or, husband or wife, right?
Absolutely. Yeah.
Okay. And then the person that can provide the training, this is what the list looks like. It can be a physician, right? But it doesn't have to be.
Right. So this is one of those things where it is kind of a sometimes therapy. So it is going to be for the physical therapists, the physician assistants, those types of speech language pathologists, also physicians and nurse practitioners too. But unfortunately, it cannot be the clinical staff, the support staff. It does need to be this list.
But still, I think it's a good trend in the right direction.
1,000%.
And just a few other things, to make sure the patient must agree to this, right? So if you're going to provide, let's say the patient's wife is receiving the training, the patient would have to agree to it. However, the patient does not need to be present when the training is given. And you already touched on that this could be provided via telehealth. So I think in the past, the patient had to be there. So now this is definitely an improvement for 2025.